Rural Americans deserve access to the best of what our nation has to offer, especially health care. Across every state and every community, America's rural hospitals are the first line of defense, protecting our families, neighbors, and loved ones. No matter where you live, hospital care doesn't clock out. They're there 24 hours a day, 7 days a week, 365 days a year. Each year, America's over 5,000 hospitals care for millions of patients, providing 24/7 emergency care, delivering babies, cancer treatments, and other life-saving care that patients rely on. Behind every one of those patients are doctors, nurses, and caregivers working tirelessly to keep people healthy and safe. Hospitals are our community's lifelines. They employ our neighbors and keep our families healthy. But now, some in Congress are threatening access to care. Tell Congress, protect patient care to keep America strong. Don't cut rural health care.
LifeLock, how can I help?
The IRS said I filed my return,
but I haven't.
1 in 4 tax-paying Americans has paid the price of identity fraud.
What do I do?
My refund, though.
I'm freaking out.
Don't worry, I can fix this.
LifeLock fixes identity theft guaranteed and gets your money back with up to $3 million in coverage.
I'm so relieved.
No problem. I'll be with you every step of the way.
1 in 4 was a fraud-paying American. Not anymore. Save up to 40% your first year. Visit LifeLock.com/podcast. Terms apply.
The More Money Show with Steve Moore on the Red Apple Podcast Network.
Welcome back, folks. This is the More Money Show on a beautiful Saturday afternoon all over the Northeast and Southeast. I'm in the Washington, D.C. area, and I hope you're having a wonderful Saturday. Remember to get out and get some fresh air and some sunshine and enjoy this respite from what's been a brutal winter so far all over the East Coast. So I'm going to be taking your calls in about 10 or 15 minutes because I love to hear from you all. We're live. We're in color. We're about the only station, by the way, that is live on a Saturday afternoon. And so please call in if you have views on any of the things we've been talking about. But most especially, as I said, I'm not an expert on the military. I'm not an expert on foreign policy. So I want to know from you whether you approve of what Donald Trump has done with these strikes in Iran. I'm still learning about it, so I don't have a strong opinion one way or the other. I do not want America to be the world's policeman. On the other hand, when you've got somebody who's murdering tens and tens of thousands of people, do we have a moral obligation to come to their defense? I don't know the answer. I'm just asking the question. There's no question that Khomeini is a very, very bad guy, and his lieutenants are as well. They are like Nazis that are just killing people indiscriminately to hold on to power. So that number, by the way, for the More Money hotline is 1-800-848-9222, 1-800-848-9222 or 1-800-848-WABC. But before we get to your calls, I have asked my good friend Cynthia Fisher, who is a hero of mine. Cynthia Fisher is the Paul Revere of healthcare, calling out and warning Americans about the runaway costs of our healthcare system. And she has got an answer to the problem, which is that every single time you go to the hospital or a doctor or a clinic or you buy a pharmaceutical drug or a prescription drug, you should know what the price of it is, because we do not have price transparency in healthcare. We have price transparency in just about every other thing we buy. You go to the grocery store. Can you imagine going to the grocery store and there are no prices on anything? I mean, how could you shop? And then you go to the checkout, line, and they charge you $400 because you had no idea what things cost. That's how our healthcare system works. It's rotten to the core. It's only working for the big hospitals and the insurance companies. And the person who is going to bring that to an end is Cynthia Fisher. She is a good friend. By the way, I apologize, Cynthia. I forget the name of the organization that you have started on the need for healthcare price transparency. What's the name of the group?
Oh, thank you, Steve, for having me on today. And yes, our organization is called PatientRightsAdvocate.org. That's PatientRightsAdvocate.org.
Advocates.org.
And
okay.
we know this show is more money, Steve, right? How do we put more money into the American workers' paychecks and American families' budget is to be able to save our own money and benefit from competition and consumer choice like any other market everything in our economy is under a free market, right? Other than healthcare. So when
not healthcare, right? By the way, healthcare and education are the two.
We can lower our costs.
Yes. So
healthcare and education.
you got a great shout out from the president for this issue in the State of the Union. He said we have to have healthcare price transparency. You and my buddy Arthur Laffer, who's a mentor of mine and yours, really have put together. I mean, I'm so impressed by the way you've taken an issue and you rode with it now for the last several years, and all of a sudden people are waking up to the fact that the whole system is corrupt, that nobody knows what anything costs. Tell my listeners, you have some amazing statistics about, like, you go to one hospital and it's like $4,000 for an MRI, and then there's another hospital down the street and it's only like $800, and people don't even know how to shop around.
Well, that's right. As long as people are blind to no prices and blindsided by outrageous bills, they have no idea whether they're even paying when they get those bills the correct amount that was negotiated by their plan. Neither the workers that have it through their health care coverage through their employment, nor the employers, because the industry, both the hospitals and the insurance companies, have been in cahoots to keep prices hidden. And know now that over 6 years, when President Trump came in the first administration, we worked with the first administration to show them that existing law had given all of us, we are the true purchasers of healthcare, whether we get our coverage through our employment or the exchange, or we get it through Medicaid or Medicare. We are the true purchasers as workers and taxpayers, as the American people.
That's right.
And share that with the American enterprises and even the public sector, the school districts and the state governments alike. However, the industry has cleverly used obfuscation to charge whatever they want. And so many families, nearly everyone has a story of some member of their family being crushed by medical bills they never expected to pay, and just try to find out if it was correct or not. And then the hospitals sue for balanced bills, which they were supposed to stop doing with the No Surprises Act, and garnish people's wages who already have two jobs, right, in this country, or put a lien on their homes. And this is just, if you think about it, we also see the insurance companies denying coverage when, in fact, in the plan, the coverage was supposed to be covered for a hernia repair or an appendectomy or even childbirth. Let's be real. The reality is the Trump administration, the first time around, Steve, as you know, made the hospitals and the insurance companies have to show prices, because we looked at three existing laws, one being even the Affordable Care Act, gave us the right to know all standard charges before we get our care. And when we get our bills, we should be able to audit them against the price, right? And even insurance companies, big insurance carriers, I mean, this is what they do, the employers. If you're an employer and you want to get access to make sure the payments match the prices, they say, well, pound sand, you don't get coverage for your workers unless you sign an anti-audit provision. And they only let them review 250 claims. I smell a rat there, Steve. So, the reality is we have to thank the president, because in his healthcare plan, in this great healthcare plan, he came out and said he wants to maximize price transparency, and he wants all those billing claims to show everybody's fee of what all the middle players are charging that are totally non-value, that we should be able to lower the cost and directly pay that provider in time and cut out all the unnecessary fees and overcharges and upcoding.
So a lot of people think that, why should I be concerned about the cost of healthcare because I've got health insurance coverage, or I have Medicare, or this or that, or I have employer coverage. But one of the things that you've taught me, and it just makes sense, it's just obvious, simple economics, that, when the employers have to pay, sometimes $15,000, $20,000, $25,000 or more for workers' health care because they cover the cost, guess what? That means they can pay they're going to have to cut the pay of the workers, because if the package is too big, they can't afford to pay them. In other words, people would have more bigger paychecks, right, Cynthia, if it weren't for the runaway cost of health care, because then it wouldn't cost the employer so much money. And the only way they can pay for it is to cut the pay to the workers.
Rural Americans deserve access to the best of what our country has to offer, especially health care. Across every state, every community, America's rural hospitals are the first line of defense, protecting our families, neighbors, and loved ones. No matter where you live, hospital care doesn't clock out. They're there 24 hours a day, 7 days a week, 365 days a year. Each year, America's over 5,000 hospitals care for millions of patients, providing 24/7 emergency care, delivering babies, cancer treatments, and other life-saving care that patients rely on. Behind every one of those patients are doctors, nurses, and caregivers working tirelessly to keep people healthy and safe. Hospitals are our community's lifelines. They employ our neighbors and keep our families healthy. But now, some in Congress are threatening access to care. Tell Congress, protect patient care to keep America strong. Don't cut rural health care.
This episode is brought to you by Indeed. Stop waiting around for the perfect candidate. Instead, use Indeed sponsored jobs to find the right people with the right skills fast. It's a simple way to make sure your listing is the first candidates see. According to Indeed data, sponsored jobs have 4 times more applicants than non-sponsored jobs. So go build your dream team today with Indeed. Get a $75 sponsored job credit at Indeed.com/podcast. Terms and conditions apply.
Well, not only that, it's really because the workers actually are the insurance carriers, because they're paying for the insurance premiums with the employers, right? It's coming out of an automatic deduction from their paycheck. And then what adds things even worse is because the insurance industry has been gaming it, because the higher the charges are, the more the insurance industry makes. There's a big flaw in the Affordable Care Act that allows both the hospitals and the insurance companies to profiteer at higher and higher and higher charges. So it's a perverse incentive. So then what employers have had to do is push down high deductible plans to the American families. And many people don't even have $400 of savings. And what we find is they'll have a $2,500 per person deductible. Some are even at $6,000 high deductible plan. And so people don't get the care they need for the fear of financial ruin, because they don't have that kind of money to pay for care. So the reality is that we can lower all of this, Steve, because prices vary. From the first Trump administration starting to get hospitals and insurance companies to show prices, even though they flout the law by and large, what we're seeing is, like you said earlier, there's a 10 times difference in what the insurance plans negotiate at charges, even in the same hospital on the same day. Let me give you an example. Is we should have the right to pay the fair market price. So as you know, what Trump just did in this Great American Health Plan and in the State of the Union, he said we need to put in place maximizing price transparency. So you or I could search on Google, we could ask Siri, we could use ChatGPT, and we could say, let me know the closest place to get an MRI at the best price. And MRIs are a commodity now, you know, and so when you look at standalone imaging center paying cash money for an MRI, no one should pay more than $300. $300. And yet, if you go to Mass General in Boston, my husband's Blue Cross plan bill for an MRI is $7,500 with a $2,200 copay out of that.
That is so crazy. I mean, the thing is, you know, like as you know, I travel a lot as you do. And so, you know, when I have to take a trip somewhere, I just go to, you know, Google Flights or something like that. And the airlines compete, you know, with each other in terms of lowering price. And I say, oh, I'm going to take this flight because this one's only $250 and the Delta flight is $450. In other words, you can shop around online. You should be able to do that with healthcare, but you can't. You know, you could basically say, okay, I need an MRI. I live in Washington, D.C. I'm going to push the button on my phone. It'll say, hey, you could get an MRI at, Mass General for $400 instead of $2,000. But that's not the way the healthcare system works.
That's absolutely right. But it can change, and it is going to change. And let me tell you, the transparency train has left the station. Yes, we got New Yorkers, many that listen in, and East Coast folks. But I'm going to tell you, that train's left the station. And the more we're pulling back the curtain, we're realizing, look, the president also wants most favored nation. That means he wants to make sure we as a country aren't paying more for drugs than other countries. But the reality is, the way he gets there is we first have to see all of the prices in drugs. What is the net price? And I can give you the example that this is such bipartisan supported by both sides of the aisles, because over and over, people want and know that they won't be hosed or fraudulently or erroneously overcharged if they can get access to prices up front, itemized bills, and then be able, when they share the payment with their employer or the government, see, in fact, that what the amounts were and who got what. Now that's, we get it even when we take our car in for repair or we buy a car. We can trust the car dealership a heck of a lot more than we can trust our hospital or insurance carrier right today. Amazing. Why? Because trust equals transparency, and we can drive down those costs. Congress in the Senate right now, and the president called a month ago. He said, I am looking for bipartisan Congress, bicameral, to put into play what is supported by 96% of the people in this country in the polling, is to deliver maximum price transparency and accountability in billing and payments. This is huge because Senator Marshall and Senator John Hickenlooper both have the Patients Deserve Price Tags Act, and we understand that is soon ready to go to markup in the Senate, and it has strong bipartisan support by over 10 Democrats and 10 Republicans.
Well, Cynthia, it is moving, and you're the one who is moving this. I remember when you first told me about this idea a couple of years ago, and you're winning, and that's the good news. And I'm going to end with this question. We've only got 30 seconds left. I believe, and you tell me if I'm wrong or right at it, I believe we could get better health care outcomes in this country, better health at half the cost with this kind of reform.
Well, that's absolutely true because, that is on par with other developed countries. But the only way we can get there is to see the prices and then let everybody benefit from the competition and choice. Yes. And I'm really encouraged. I just spoke to over 6,000 independent orthopedic surgeons yesterday. They all want to show their prices, and they want everybody to know where the lowest priced MRI is, where the lowest price of PT to make it efficient that people can get physical therapy when they need it, wherever they need it, and even be able to do it digitally and remote with someone if they can't get access easily. So
there's an old saying that,
and they say, look, knee replacement should be $17,000. There's no reason why a hospital should charge over $70,000 for a knee replacement. And so they want to drive down the cost, and we can get there.
When you have competition, you get lower prices, and we need more competition and transparency. Cynthia, keep fighting. I want you to come on in a couple of weeks, give us the latest update on this. You have President Trump in your corner, and that counts for a lot. Folks, when we get back, we'll be taking your questions and comments, 1-800-848-9222. I understand there's one line open for people who want to call in. The next rest of the show is your opinion on all the stuff that's going on. Do you approve of what Donald Trump has done in Iran? I'd like to hear from you. You may know more about this than I do. This is the More Money Show on WABC.
Thanks for listening to More Money with Steve Moore. You can hear More Money with Steve Moore Saturday afternoons at 1. If you like the podcast, share it with your friends and listen anytime at WABCRadio.com and download the WABC Radio app. Hit that subscribe button on all major podcast platforms. Plus, follow WABC on social on Instagram, TikTok, Facebook, and X. See you next time for a new episode so you never have to wonder,
what the heck is going on here?
Rural Americans deserve access to the best of what our country has to offer, especially health care. Across every state, every community, America's rural hospitals are the first line of defense, protecting our families, neighbors, and loved ones. No matter where you live, hospital care doesn't clock out. They're there 24 hours a day, 7 days a week, 365 days a year. Each year, America's over 5,000 hospitals care for millions of patients, providing 24/7 emergency care, delivering babies, cancer treatments, and other life-saving care that patients rely on. Behind every one of those patients are doctors, nurses, and caregivers working tirelessly to keep people healthy and safe. Hospitals are our community's lifelines. They employ our neighbors and keep our families healthy. But now, some in Congress are threatening access to care. Tell Congress, protect patient care to keep America strong. Don't cut rural health care.